Hello students, let's study sterilization and disinfection. Sterilization process by which all living microorganisms including viable spores are either destroyed or removed from an article or from the surface medium. Results in the reduction in more than 10 to 6 logs colony forming units of microorganisms and their spores. Disinfection process that destroys or removes most of, if not all, pathogenic organisms, but may not destroy bacterial spores. So result is reduction in 10 raised to 3 log CFU in most organisms and not spores, achieved by physical agent or chemical agent, usually used only in inanimate object, not on body surfaces. Factors for efficacy of sterilant or disinfectant: organism load, nature of organism, concentration of the disinfectant, contact time, temperature stability and relative humidity, biofilm which prevents the entry of disinfectant. Or property of ideal disinfectant is a broader microcidal activity, fast acting, not affected by environmental factors such as organic matter, non-toxic, compatible with surfaces, odorless or pleasant odor, economical and environmental friendly. The sterilant, which kills all bacterial spores, tubercle bacilli, non-enveloped viruses, fungi, vegetative bacteria, enveloped viruses. So examples are the physical methods: steam sterilizer, that is autoclave; dry heat sterilizer, that is hot air oven; filtration; radiation, ionizing and non-ionizing; others like incineration and microwave. In chemical method, ethylene oxide sterilizer, plasma sterilizer. So Spalding classification for medical devices. So critical device, that is high risk. So items that enter normally sterile sites. So recommended method is sterilization, and the medical instruments like surgical instruments, implants, prostheses, rigid endoscopes, syringes, needles. Semi-critical device, intermediate risk. Items in contact with mucous membrane or body fluid. The recommended method is disinfection, high-level disinfectants. Examples are respiratory equipment, non-invasive flexible endoscopes, bedpans, urine bottles. Non-critical, low-risk item in contact with intact skin. Disinfection, intermediate or low-level disinfectant. The examples are non-critical patient items, non-critical environmental surfaces. Hello students, let's study moist heat. So in that we will see autoclave in detail. So it also called as steam sterilizer. The principle: when water is heated in closed container, it produces vapor and then it causes vapor pressure. Then when water boils in closed container, the vapor pressure is increased more than the atmospheric pressure, and then it has a more penetrating power to kill the organisms. And the mechanism: killing of organisms by irreversible coagulation, denaturation of enzymes and proteins. The types of autoclave are horizontal when it is in large volume, and it is mainly used in CSSD department. And the vertical one is in small volume, used in most laboratories. The components: there are three main components: pressure chamber, lid and electrical heater. So pressure chamber is consists of the large cylinder, either vertical or horizontal. It is made up of metal or stainless steel, and it has a steam jacket, that is water compartment at the bottom. The lid: it has discharge tap for passage of air and steam, pressure gauge for the pressure measurement, and safety valve to remove the excess steam. An electrical heater: it is attached to the jacket that heats the water to produce steam. The working procedure: the materials to be sterilized are placed inside the cylinder. A steam jacket is filled with sufficient water, and then lid is closed with the help of clamps, and the electrical heater is put on. Now there are three phases. So first is conditioning phase, second is exposure phase, and third is the exhaust phase. So in conditioning phase, you have to give condition of temperature, pressure and time. That is temperature 121 degree Celsius, pressure 15 lbs and time 15 minutes. So after the water boils, the air in the chamber is completely displaced by the steam. So the steam pressure rises and then it reaches to the desired level, that is 15 lbs pressure. Then the safety valve opens and excess steam is removed out. Exposure phase, the holding period is for 15 minutes. Exhaust phase, so after the holding period is over, the electrical heater is switched off and the steam sterilizer is allowed to cool till it reaches the atmospheric pressure and then the material inside is removed. The care and maintenance of the autoclave. So we have to always put water in steam jacket. Do not forget to put off gas burner after the holding period is over. Never leave autoclave unattended when pressure is rising and never open the lid immediately after heating period is over. So we have to allow it to cool and then open the lid. Sterilization control, physical conditions like temperature, time and pressure, chemical indicators like external pack control that is autoclave type or Browey test or internal pack. The biological indicator spores of Geobacillus theothermophilus are the best indicator which kill spores in which the spores are killed in 12 minutes at 121 degrees Celsius. Uses of autoclave. So there are mainly two uses, hospital uses and the laboratory uses. In hospital uses, the sterilization of surgical instruments, anesthetic equipments, dental instruments, implanted medical devices, surgical drapes and linen, biomedical waste treatment for disposal. Laboratory uses sterilization of glassware, test tubes, slides, pipettes, petri dishes used in the laboratory, sterilization of culture media for preparation, inoculated infected culture plates, killing of microorganisms and the spores. Flash sterilization, it is modification of conventional steam sterilization used for the emergency or during unplanned procedure. So it involves fast sterilization, that is temperature 134 degrees Celsius for 3 to 10 minutes for surgical instruments in unwrapped condition in steam sterilizer located close to the operation theater, and it is restricted for emergency situation. Disadvantage, not suitable for porous or cannulated instrument or implants because the instruments are not packed, so they remain wet following sterilization and there is high risk of recontamination. Dry heat. So in that examples are flaming, holding instruments to be sterilized in flame of the spirit lamp or Bunsen burner. Example, wire loop, points of the forceps, spatula, scalpel, needle, mounts of culture tubes, glass slides. Second method is incineration. It is physical method of sterilization in which material to be disposed of are kept in big dig and are burnt off. It is called incineration. It burns, that is sterilizes the anatomical waste and microbiology waste by providing very high temperature 800 to 1200 degrees Celsius, converting the waste into ash, fuel gas and heat. Uses in this is excellent method for rapidly disinfectant material such as soil dressing, infected dressing, bedding, pathological material, disposable syringes, gloves, hospital waste, lab waste, etc. Disadvantage, plastic material emits clouds of the black. The third example in dry heat is the hot air oven principle. When electricity is passed through heating coils, electrical energy is converted into heat energy. The temperature is 160 degrees Celsius and holding time is 2 hours. Uses dry sterilization of syringes, needles, drying of glassware, test tubes, petri dish slides, pipettes, heating of chemicals used for preparation of standards, sterilization of oil, grease, liquid paraffin. Sterilization control of the hot air oven, biological indicator, the spores of Bacillus atrophius. The uses of hot air oven, sterilization of egg media, sterilization of serum media, sterilization of sugar media. Filtration. So filtration acts by removing microorganisms, not by killing. There are two types of filters. Depth filter used as drinking water purifier. Membrane filter widely used in hospital. Bacterial filter size is pore size is 0.22 micrometer. Filtration of air, surgical, three-ply mask and respirators. HEPA filters, high efficiency particulate air filter, removes 99.7% of particles that have size of zero point 0.3 micrometer or more. ULPA filters, ultra low particulate penetration air, removes 99.999 particles that have size of 0.12 micrometer or larger. Filtration of liquid used for bacteriological examination of water in hospital settings, dialysis water. to remove bacteria from pharmaceutical fluids that are heat labile and cannot be purified by any other means. Radiation, ionizing and non-ionizing radiation. So ionizing radiation include cobalt 60 gamma rays or electron accelerators. Use low temperature sterilization method that has been used for a number of medical products, tissue for transplantation, pharmaceuticals, medical devices. Mechanism causes ionization of molecules in organisms leading to breakage of DNA. Advantage, high penetrating power and rapidly acting. Temperature is not raised, so it is also called cold sterilization. Disadvantage, high sterilization cost and may have deleterious effect on equipment made up of polyethylene. Sterilization control, efficacy of ionizing radiation checked by Bacillus pumilus. Non-ionizing radiation, infrared radiation technology, alternate method of sterilization for selected heat resistant instrument. Ultraviolet radiation does not achieve sterilization described under intermediate level disinfectant. Test for sterilizers, the indicators, physical indicator, time, temperature, pressure. Chemical indicator, they use heat or chemical sensitive material which undergo color change if the sterilization parameter, that is time, steam, quality, temperature for which it is issued is achieved. Common types are class 1, class 2, class 4 and class 5. Biological indicators, most reliable indicator as it uses bacterial spores to check the effectiveness of sterilization. Spores are highly resistant and will be destroyed only when the effective condition is achieved. Bacillus stereothermophilus for heat sterilizer, gas, plasma, hydrogen peroxide, and liquid acetic acid sterilizer.
Hope you find this session useful for your understanding and for your exams. Thank you.